How many charts do you actually have? In this week's tip, I'd like to go over what's the difference between active chart and total charts, and how as a practice owner you should be viewing them. Hi, I'm Jeff Santone, Senior Seminar Speaker for MGE, and every week I'm out on the road and I meet hundreds of doctors. I've talked to thousands of doctors over the course of the previous 10 years, and during those conversations and talks, I'll ask them about their practice in order to assess it. And one of the questions I usually ask is, well, how many charts do you have? And the answer to that question, for the most part, is the same. Well, do you mean active chart or do you mean total charts? Because there seems to be a big difference between the two. And I look at the doctor and I usually say, well, how many charts in the last 5 years? And they don't know. They typically know their active charts. They'll say, well, in the last 12 months, I've had 1,500 charts come in. And I would challenge them, and I would challenge you to start looking at your charts differently. If we would like to plan for the practice, grow the practice, move hygiene in the right direction, we need to know what's our maximum potential. What should the office be able to do? And in order to do that, I have to have a real idea of what an active chart is and what a total chart is. And what I tell doctors to do is go back over the last 5 years and start to calculate how many patients have been in the last 5 years. And that is very aggressive. But if we only use 1 year, we're always going to be doing what we've always been doing, because the patients who have been in the last 12 months, well, they came in the last 12 months, and they're going to come in hopefully in the next 12 months too. And I could say that my hygiene department was full. So if I go back 5 years, if I go back 3 years, and I would say at a minimum you need to go back 3 years and count total number of patients that have been in the last 3 years. That's going to include everybody who made a new appointment, whether it's an emergency or coming in on the hygiene schedule. And you'll be able to get a full count of how many patients have been in. And from that number, we're going to be able to do some future planning for our hygiene department. We're going to be able to set the maximum potential. We're going to be able to set the minimum potential. We're going to be able to hire sooner, make sure the organization is busy. So when we start to look at what's a chart, active versus total chart, we should be focused on total. Practice brokers are focused on total. You as a buyer of a practice will be focused on total. And you as the owner who wants to grow your practice needs to be focused on total, not just active. And those are two very different terms. All right, good. So to calculate total charts in your software, you are usually able to download your entire database. It's usually a patient master list. And what you should do is go to that file or go to that report and ask the system to give me every patient that's been in the last, and set the date. 2 years, 1 year, 3 year, 4 year, 5 year. And it'll give you a count. It'll print this out. And then I would create a sheet in Excel and just put those numbers in. 1 year ago, we had this many charts. 2 years ago, we had this many. 3, 4, 5. And from that, you're going to be able to start to apply what we're learning. But the hard part will just be knowing where to go in the software. And I would not limit your software by inactive versus active. That's another thing we'll talk about in the future, when to deactivate a chart. I would just try to get this idea of how many total charts did I have. So I would not limit it by inactive, deactive, or any other reason, just total number of people that have been into the office, whether they've come back or not come back in the last 1, 2, 3, 4, 5 years. Get that number, put it into an Excel sheet, and we're going to start to track and see trends. Good. So now that you're downloaded that number of how many charts have been in 3 years and a year or 5 years, you start to see a little bit of a pattern of, well, I had 3,000 charts 3 years ago, and now I've had 1,500. And you could start to see that you're losing patients. And that number is going to be very important in my future tips. We're going to talk about attrition rates. You know, how many net new patients did you add if we can calculate total charts over 5, 4, 3, 2, and 1 years. If you like this video, click the subscribe button and the notification bell to get more tips like this. Also, if you have any questions about the tip I just gave, please call MGE 800-640-1140. Ask for Jeff, and I'd be more than happy to explain it to you. So stay tuned for my next tips, and we'll start using that number.